Good afternoon, everyone. Thank you so much for joining us for a meeting. I think we're just going to give people another 2 minutes to join in, and then we can start at 10 past. Thank you so much. Good afternoon, everyone. Thank you so much for taking the time to join African Alliance on our PVA Africa CSO meeting. My name is Anna Matenda Wafa, and I'm the coordinator at African Alliance. I'm going to hand over to our campaigns and advocacy lead, who is Rahab, to take us through this meeting. Thank you. Hello, can anyone hear me, or can anyone hear Rahab? Rahab, over to you.
We can hear you, Anna.
Yeah, we can hear you. Thank you.
Loud
Okay.
and clear now.
Yeah, we can hear you.
Okay, I'm going to hand over to Rahab to start the meeting. Thank you.
Okay, colleagues, I think we're having some challenges with getting Rahab, but I can kick off and just welcome everyone again, and just to say that this is quite a hectic week with both the World Health Assembly, Davos, and a range of other activities happening, including, of course, today is Africa Day, which, as we would know, what is the genesis of what we know today as the African Union. So quite a key and symbolic day for us as African civil society members. So despite our numbers, we will move ahead with the call and circulate this to all of the members who are otherwise occupied with the various advocacy initiatives that are taking place. I'm sure you would have all seen by now the Pfizer announcement around what they're attempting to do with a few African countries around declaring no profits on vaccines and medicines to certain low middle income countries, which really just keeps us in the dependent position of being reliant on pharma for our individual and collective health justice. But I'll stop there and just welcome you all again and hand over to Rahab. Thanks, colleagues.
So good afternoon, ladies and gentlemen. Welcome to today's meeting, the PVA Civil Society meeting. My name is Rahab Mwaniki. I work at the Campaigns and Advocacy at African Alliance, and I look forward to a very fruitful discussion. As you can see from the agenda, we have a heavy agenda to discuss and come up with a few things that we need to move forward. So we will look, I think we all registered, but I'm going to ask you to register your names again. And I'm also interested in getting your mobile phone numbers for ease in communication for future meetings, and also for any quick communication that needs to happen. As you'll see, there'll be a few activities we need to do. We will also look at the Africa COVID-19 update. We had ministers, member states meeting in Addis Ababa, and others was virtually, and those discussion on the current COVID-19 situation in Africa. We look at the PVA Africa, whom we are all about. We'll also look at the second US COVID summit that happened in May. And then we look at some of a few campaign moments we have in the next 1 month, and we discuss how we're going to move forward. So looking at the African COVID-19 update, the continent has a population of about 1.3 billion Africans. And out of the 54 countries in Africa, only 53 have been able to account. One country, there's no sufficient data, so that's why you have only 53. And Africans who've taken the first dose are only 23.3%. And the population that is fully vaccinated is at 17.7%. And that is from the WHO site. That this is the latest data as from 23rd of May, 2022. If we look at the actual doses, you can actually see that the doses received in Africa was 790.7 million, and those administered are 554.2 million. And that's where we get the figure of the number of doses. So even as we get 790 million doses, only 70% has been used. And this is varying. As you can see the list, there's Moderna, there's AstraZeneca. So it depends with what each country has been able to receive. At the moment, and you can see from the graphics that is provided, there's reduced urgency on vaccination among public and government. Right now in Kenya, we're in campaign mode for national elections. Little is going on in terms of COVID-19 vaccination. There's no masking, there's no social distance. It's all about campaigns, and many countries. Some countries, including South Africa, are experiencing surges in infections. It has been in media since May this month, the beginning. And of course, you've seen from the data that there's low COVID-19 immunization coverage, which reflects lack of commitment and quality of social mobilization. And in general, there's an exposure of weak community engagement and planning capacity of many African health systems. We have the World Trade Organization TRIPS negotiation challenge, and the argument that a waiver is no longer needed as supply is not an issue. Of course, we have quite a number of vaccines available. So, but that should not mean that we don't need the TRIPS negotiation to favor low middle income countries. Effects of COVID is there, issues of long COVID, including the socioeconomic effects. You may recall the last 2 years, we've had documented evidence of increase in sexual gender-based violence. Many Africans have lost jobs, many economies. Our African countries have lost income due to lack of people going for jobs, taxes are not being remitted as usual, and this is affecting the quality of life of Africans in our continent. So we have been doing quite some amazing piece of work here at PVA Africa, which you are part of. And one of the piece of work that has been going on is the Mother's Film. The African Alliance has begun the process of documenting a tale of two mothers and two daughters, connected across continents by loss and legacies of love. It is envisioned that the new film will shine a light on the violence of COVID-19 vaccine injustice and the new generation of activists in South Africa, in the US, in fighting to ensure the lack of access to dignity and healthcare becomes history. This webinar, we held it in commemoration of World Mother's Day, International Mother's Day. And I have to say that the turnout was impressive, being a Sunday. And we had quite rich experiences from the two families that shared the experiences of losing COVID. We have engaged in key and strategic campaigns. One of it is a leaked text on the World Trade Organization, and quite a number. In April, we, as African Alliance, there was a letter written to Ghana support for PVA Global Campaign Statement that was endorsed by Muslim and Christian leaders, reminding world leaders that the COVID-19 pandemic is far from over, and the Muslim leaders were positive, with many signing the statement. This is a positive, knowing that Africa, we give a lot of credit, a lot of strength in engaging our religious leaders. The African Alliance shared the PVA campaign statement with Muslim leaders to get their support by signing the statement, which was released in May in preparation for the second Global COVID-19 Summit that we will be discussing later. The statement aims to call on world leaders to take immediate action to address global inequalities in access to COVID-19 vaccines. And the African Alliance received signatures of endorsement from the following Muslim leaders during Ramadan. So the list is not there, but we had like 10 Muslim leaders, strong leaders of the Muslim faith who signed on to the letters. So we also have been engaging very actively in media. So on 23rd of March, Tian Johnson, the founder of African Alliance and the lead strategist, and also the community co-chair of Africa CDC Vaccine Delivery Alliance, shared reflections on how to make progress in the push for vaccine equity as the world enters the third year of the pandemic, and what African civil society organizations are asking for now, and the link is there. On the 31st of March, Tian also spoke to BBC World Radio about the need to continue pushing to ensure that people on the African continent have access to testing, as test kits are currently expensive and out of reach for many. In terms of influencing, sometime in the beginning of the year, that is February 2022, the African Alliance took part in a campaign driven by the People Vaccine Alliance and signed an open letter to the Moderna CEO and chairperson, calling Moderna to immediately withdraw the mRNA vaccine patents it had filed in South Africa and to provide technical expertise to the WHO mRNA hub in South Africa. So as we enter the third year of the COVID-19 pandemic 2022, the African Alliance called on leaders to act to end COVID monopolies. And in March 2022, the African Alliance participated in the End COVID Monopolies campaign together with its regional partners in Asia and other parts of the world. In April 2022, there was reaction to the complaint from a broad civil society coalition, including the African Alliance. The United Nations condemned countries blocking the TRIPS waiver for racial discrimination. In terms of partnerships, in April 2022, the African Alliance reached out to Sofepadi, a woman-led organization based in the Ituri province of DRC Congo, to be their Central African regional partner. Sofepadi was established in 2000 with a mission to promote and defend the rights of women and girls in order to ensure that mothers and children have access to their basic rights. Current lessons is we have learned that African governments receiving vaccine doses also at near expiry date and cannot access newer treatment for COVID-19 for their market. We have the issue of intellectual property and TRIPS waiver, which continues to be a stumbling block to the manufacturing of commodities and technologies. And we know there's still demand for creation. We need to create demand for vaccines and technologies in our continent. We want to now look at some of the countries that we have worked in the last quarter. These are not just the countries, but just a few that we have worked in the last quarter. So we have Democratic Republic of Congo, which has very low vaccination rate with under 1% coverage of the general population and 2.5% coverage among healthcare workers by mid-April. So DRC faces multiple complex emergencies with 30% of the population in need of humanitarian assistance in 2022, resulting in competing priorities. Vaccination campaigns to vaccinate 11 million Congolese by July 22, that's a target, yet they are at 1%. So a pastoral letter was issued during the Easter holiday by the Catholic Church to encourage vaccination among the faithful and the general populations. There are plans to utilize a purple visit in July to further encourage this. The Senate President advanced World Bank Memorandum of Understanding of sorry, $200 million and sent them to the president for signature, and blocking a critical funding bottleneck. There's an agreement by the Senate President to advocate to the Minister of the Interior for vaccinating police and the military forces. There's agreement to bundle COVID-19 vaccination with polio and measles campaigns in terms of richness. I think for those who've been to DRC, we know that's a country that is very vast in terms of coverage. And then the infrastructure is also not very good for health. Provinces, including Kasai Orientale, with higher vaccination coverage, has demonstrated that engagement with authorities, especially the governor, is critical for successful vaccination campaigns. There's an agreement on 1.4 million doses at risk of expiry by end of May 2022 that will be used in campaigns. So we look at Ethiopia, and there has been remarkable progress with Ethiopia, increasing the number of people vaccinated by 5 times, though facing a complex set of needs due to conflict and humanitarian emergency that has now gone on for almost 2 years. Over $4.4 million in funding was provided from UNICEF and WHO to support COVID-19 vaccination operational costs in the Tigray region, where there is ongoing civil war. The funding will also support integration of COVID-19 vaccination with the upcoming childhood vaccination campaign in May 2022. Ethiopia is working to improve subnational access to COVID-19 vaccines with plans to integrate at the health post level following upcoming campaigns. Contracts for 5,000 surge support health workers will be extended beyond June 2022 with the World Bank funding consented by the Ministry of Finance. And I want to bring to your attention the WHO. One of the themes for WHO is the healthcare workers. The clarion call was fit for purpose. We need to get healthcare workers that are able to take care of the needs of the African continent. That's where they need to be fit for purpose. Then Ethiopia will complete the primary series of AstraZeneca among those who received their first dose. COVAX approved the request for additional AstraZeneca doses. Most of you are aware, I've spoken with most of you in terms of clarification of this call, and we are happy that we will, this call is available for indigenous organizations in Africa with 5 focus areas that advocate for equitable, affordable, and proportionate access to national and regional vaccines. Campaign to highlight the contribution of pharmaceutical companies. Then we need COVID-19 medicine, test, and treatment to cover all low, middle income countries. So we are talking of diagnostics, we're talking of drugs and other health technologies. The call is also calling for strategies on how to advocate for increased domestic accounting for fully funded inclusive COVAX at the country level and also at the global level. We are looking for, it's also looking for strategies on how we can do skill strengthening, including media visibility and intellectual property rights. And then most also importantly, movement building. We need to strengthen our movement building across Africa and go back to the ages where we would have one movement when we had one strong agenda, like in the HIV or in terms of justice and all that. So the deadline is on 30th May, which should be next week. The Q&A webinar was held on 20th May, and you can get the recordings on YouTube, and you can also check all the other relevant information on the website for African Alliance. So second US COVID-19 summit, it was hosted, it was virtual. It was hosted, it was virtual, it was hybrid, virtual and physical, and it was hosted by the US president and also co-hosted by Belize, Senegal, Germany, and Indonesia. And President Biden called on high-income countries to give 1.2 billion for vaccine. And this is not what is in COVAX. This is the addition. 1.2 billion for vaccines. He also called on other countries to give 2 billion for treatment and $1 billion for oxygen supply. You may recall that when COVID happened, Africans started buying cylinders of oxygen to put in their house in case they got sick, then they had access to oxygen. So oxygen is still a very key thing in our healthcare system. And because of the manufacturing thing, it's that the manufacturing, the container is more expensive than the content. That is what sometimes is very expensive for the industry and for the end user, who is the hospital. So also at the summit, the United States National Institute of Health finalized an agreement with WHO COVID-19 patent sharing facility, that is what we call CTAP, to share patent rights on 11 government-funded coronavirus medicines and vaccine technologies. And this you can get from the Health Policy Watch News. And there was a call to redouble efforts, global efforts to control COVID-19 pandemic and prepare for future health pandemics and emergencies. And leaders were also called upon to accelerate financial and policy commitments from country by country and community by community. We have, with all this happening, we still have international days for action. We know WHA is taking place. We have the World Trade Organization Ministerial Global Action that is happening on 12th of June. And I think if we are talking of TRIPS and IP issues, I think as an African region, we need to have our voice heard, and we need to be on the streets if it entails us to go to the street, but we need to do a very good campaign in the next 1 week. So there's also the International AIDS Society Conference in Montreal, Canada, the last week of July and the first week of August. That's also another opportunity for engagement. And then we have United Nations General Assembly Summit and the Global Citizens September concert, which may happen in South Africa or Botswana. That is still at the planning stages. And we are happy that this one is coming to Africa. So we should be very active prior to the meeting and also maybe during the meeting in September. So I think I want to stop there and just ask now the plenary. But before we discuss strategies, I want to invite Tian to just talk about AVDA. What is AVDA and what are the opportunities that we have as an African region for engagement? So thank you. Oh, sorry. So let's just move on. Tian will join us at some point. So as I want to open this up, I don't want it to be a lecture or something, but I want we And I want people to raise their hands, and Ruth and Anna will help me identify the participants. So how do you think we need to move forward in the next 1 month? So just to remind you that these calls will be there monthly, and we will strive to give you good notice of when these meetings will happen, but we need to agree even in this meeting how often we will be meeting and on what date, so that we are sure that on this day of this month, we have a meeting. So I want volunteers to just give campaign strategies on how we need to move forward. We need to know that PV Africa is about membership. PV Africa is as strong and active as its member. It's not about African Alliance. African Alliance is just a host of the platform. Thank you, Vasi. We will share, we will put the presentation on the website, and we'll share with you also through email. So any reactions on how we need to move forward in the next month? Before we come back in June, because we'll have the next monthly meeting in June.
Yeah, this is Mwaniki.
How do we need to move forward? Yes,
Can I say
Professor
something?
Mwaniki. Welcome from Nigeria.
Thank you. Thank you. It's a pleasure to be here in South Africa online. Yes, I think for me, yes. Can you hear me? I can hear you.
Please proceed.
Can you hear me? I can hear you. Can you hear me?
Yes, we
Hello?
can.
Yes, we can hear you.
Oh, thank you. So yes, I think for me, there is a point for us to be able to do 1 and 2, 3.
Anna,
is
can you
very
hear me?
important. Yeah, for us to do 1 and 2, 3 is very important. Media and CSO engagement is very important.
Anna?
I think, yeah, Ruth, Rahab, you can hear me. I think others
Yes,
can hear me.
please go ahead.
All
Yes,
right.
we can.
So I think for me, this is one point that we probably will have to concentrate effort at the beginning, where we truly mobilize partners in country and build that competence to understand the issues around A and B, accountability and tracking. And once we can do that, we then will be able to transit to doing that accountability and tracking. For example, back here in Nigeria, there's the CSO Accountability Forum. I think.
Can anyone hear me?
I think yes, I think Rahab has a problem with that, with hearing. Maybe we'll need to help her. So, for example, like here in Nigeria, we have the annual Accountability Forum. I think getting people to understand, and it's a really big thing. It's a point where we actually engage the policymakers. And it's really strategic, but the community needs to understand the issues around A and B first, before we then move on to that platform where we start to engage critical stakeholders. At least that's in my own country. And even for the media to start pushing out and storming the space. So if we can do a number of things around media and CSO engagement at the country level, I think that's the way to go. Thank you. Over.
Thank you, Mwaniki. Any other intervention? Kavengo, please. Yeah.
Thank you very much, Rahab, for the good presentation, even though I found you a few slides away. But I think I followed very well what you said. And I want to begin by saying that it's very encouraging.
Oh, Kavengo is
sorry.
muted.
Yeah, can you hear me?
Yes, yes.
Hello.
Yes, please proceed. Okay.
Hello. Can you? And the colleagues.
Yes, yes, we can hear you, though the background is a bit.
Okay, sorry. Yeah, I wanted to begin by saying appreciating the presentation you've just made. I think it was very good. I joined when you were a few slides away, but then I followed, and I think I've understood very well what it is that you have explained in the presentation. But more than that, I also wanted to appreciate the nature of activities and work that PVA has done so far. By way of, for example, that you pointed out from various quarters, including governments, including farmers, including, you know, all those important quarters as a reaction to the kind of campaign that PVA has been conducting. I think that is very commendable. We might be still a distance away from actualizing or achieving the kind of things that PVA is advocating for, including TRIPS waiver on the manufacture and distribution of vaccine, COVID vaccine. But the fact that people who should notice or who should listen are reacting, I think that is encouraging, and therefore it should motivate us to continue doing more. Yeah, as when it comes to exactly what could be done, I think in going forward, I think it would be important to try and speak or allow space for community voices to be heard wherever they are. We know there are so many people telling the African story in their own words and on behalf of Africans in ways that is, you know, to their own understanding, and we can forgive them for that. And sometimes they are told so well, so convincing, that even when the position is not tenable, being the only perspective there is, which is convincing, it begins to look like real. So going forward, I think PVA, and I mean PVA Africa in this case, we need to strengthen the stories, telling the stories from communities and by communities, whatever that might mean to all of us, that we allow space. For example, in your presentation, you correctly mentioned the situation as it is in DRC. It is also the same in Burundi. They are still at less than 1%. It is also the same in Chad. So what is exactly happening in these countries? So I think I'm a little skeptical. I'll be a little bit skeptical to read and agree with a perspective by a Western media house pretending to have come to Africa and identify this or that as the real situation that is happening there. Personally, I've been able to speak to colleagues in DRC. I've even spoken to journalists from those countries. Their story is completely different from what I am reading from the global or Western media. So we need, therefore, to find a way of allowing our people to tell their own story about what is happening. I know the easiest story to say or to sell about DRC, Chad, and Burundi is vaccine hesitancy. And there are so many things that we know are in play in these countries. Nobody here, including on this forum, would suddenly allow somebody showing up onto their doorstep one morning carrying syringes and bottles of medicine to treat them for a disease they don't understand. Nobody. None of us. I wouldn't accept that. So what is happening here? Is this side of the story told that some of the communities could completely be unaware, you know, of what is happening? I was sharing with one of you the other day about a story, a conversation I had with journalists from Eastern DRC, and they told me that there are people who are very aware about COVID pandemic and so scared of death that they want the vaccine so bad. But when it comes now to accessing it, to access that vaccine, they have to pay up to about $30 US. $30 US in African currency, whatever your currency is not small money. Some people work for $30 a whole month. Now, and they told me in such instances where people are so desperate to get this vaccine, they are crossing to countries like, for example, Rwanda, where it is accessible for free, because in the case of their country, the government institutions are illegally selling these drugs. Is somebody telling these kind of things? There are then the large number of people who have never heard about what this disease is in the first place. They are very busy fighting. As you know, the Eastern DRC has about 100 very armed and very violent groups, so that there is no time to listen to a radio about a vaccine. All the time people have is to run away for their lives. So when we say, we package all these as vaccine hesitancy, I think is wrong. Sorry for taking your time. Thank you very much.
Thank you, Kabengo, for very good interventions on the issues of access and health justice. I want to invite Vasi.
Thanks so much, Rahab. Thank you so much for the presentation and also to the last speaker, to Kabengo. I think you raised some very pertinent issues. Even me sitting here, I've always thought that the vaccine hesitancy that we see around is what's accepted in published journals and articles and things like that. I did at one time say that maybe we need to do some sort of a research to see exactly in each country what are the reasons for this type of hesitancy. Is it that the fact that they're not educated enough about the infection, and so therefore people are hesitant, and like you said, one won't just have trust in somebody just presenting a syringe and a needle to them without having explained the basis and for why and what. So I think that for me is such an important factor. I myself never ever considered something like that. So I think for us, one intervention will be to start to educate our people, on the COVID, on vaccine production, the manufacture of vaccine. I think that's also important because people are also reading the stories about, the fake news that come around the vaccines and things like that. And that's also causing this fear and scare. And so we cannot really blame people when they don't have the knowledge and they react according to what their instincts are. So I think for me that's also very, very important. And then the other thing that I want to bring up is in terms of the acquisition, I know that we in South Africa, we've got massive production of the vaccines, but unfortunately we don't have the buyers. So, it's important that Africa starts to look at buying locally so that we can actually support, the continent. And in that way, we can make sure that we can have enough vaccines for our people as well, and not at a massive, price. And with the TRIPS waiver taking so long to actually get waived, it's really a big, it's a big challenge for us to get vaccines at cost-effective prices and in order to be giving this to our population. And, we all know that in Africa, we still struggle with finances and things like that. So it's something that we can be looking at, is how can we start to, a campaign around the leaders to start to buy local, to start to buy within the continent. And so I think that's something else we can look at. And and I think for me, the reasons for the hesitancy, I think now we should dig deeper than the reasons that are always thrown to us, in terms of religious reasons, in terms of the mistrust in the vaccine and the fact that it was made so quickly and what it contains and things like that. So so that's, Rahab, I think some of my contribution. Thank you.
Thank you, Vasi, for bringing out the issue that we are already manufacturing the vaccines, but there's no market. So we need, as African citizens, we need to create and tell our governments they need to buy products from Africa, because this is a ripple effect. The minute vaccines are manufactured in Africa, they need starch. Starch is potatoes, maize. It's a farmer who is going to grow the product. It's the youth who are highly unemployed in African continent who will do the jobs, from manufacturing to delivery, to the supply, to the distribution. So it's a ripple effect when you look at the manufacturing agenda. And I think we need to not waver on in terms of TRIPS and IP and all that, the whole agenda. I want to invite Barak, and then after Barak, we have Christine Yakwama.
Thank you, Rahab. Hi, everyone. My name is Barak Owino from African Alliance in the Partnership and Advocacy a bit. So for me, just to reiterate what the rest of the team have put forward in terms of communication and social mobilization is very key. And for Kavengo, I echo your sentiments in terms of the conflict zones. If we could map the specific areas within Africa that are prone to conflict, probably arid and semi-arid areas as well that are having these challenges, not necessarily hesitancy, but then the logistics, are they getting all this information? Then we can create a form of communication and advocacy so that this vaccine can reach all that. And just in the recent US COVID summit, there was communication about the AU and the ABDA working on reaching 70% of the African population with this vaccination. Currently, from the data, we are 23%. So that means there's still more to cover, and there is we need about 900 million people to be vaccinated, which translated to around 1.8 billion doses of the COVID-19 vaccine being procured and distributed across Africa. So for this to function as PVA, we need to actively monitor, especially what we have the media just serving as that bridge between government and the civil society, what is being communicated, monitoring if there is the procurement of those vaccines, where are they, tracking them, ensuring that they reach to the people who need them most. As we keep on talking about the trip waivers and all that, in the summit as well, Biden talked about giving the licenses for manufacturing of these vaccines out to the public. And there is a notion that these licenses are just from the US government and not from the pharmaceutical, the way we had anticipated and the way what we are working towards and calling for. So just as a roadmap, because we don't know what will happen in the future, probably another pandemic coming up, we need to be ready, just again, with as Africa emphasizing on the need for this technology to come to us. So I'd encourage that within the PVA, whichever a platform you use, be it social media, be it if you have interviews within the mainstream media, please share it with us so that we can help amplify the message. Tag us in your tweets, in your Facebook, all across, so that now we amplify all these messages together. If you have probably articles written, blogs, and all that, I'd also encourage us to share it with us so that now we amplify all this together. We speak with one voice collectively to achieve our objectives. Thank you.
Thank you, Barak. Christine.
Good afternoon, everyone. My name's Christine. I work at the subnational level. We work through a partnership with a PAP which initiated called Kakamega MNCH Alliance. On vaccine hesitance, I'd like to say that what we've done, we partnered with the county government of Kakamega and we conducted mass communication whereby we will go around the 12 sub-counties during market days with the promotion officers from the Ministry of Health. And as well, we have the nurse with us in a vehicle. And what they will do is that we'll try and sensitize to the community about the importance of the vaccine. And then what they'll do now is when now they'll get rid of the health facility nearby, and they attach the CHVs with the households, and then they do an outreach in select churches or even polytechnics. And then what they'll do, they'll mobilize the community, they go for the COVID-19 vaccine. But now the challenge I'm seeing that we had is there was some myths and misconceptions, especially with the media people, what they were airing on media. And I remember the CS for Health, there's a time we convened a Zoom meeting between the civil society, all stakeholders, and also the media people, and he told them the information that they are airing should be true and valid. And it's again, he used that platform as well, also to educate the members of media about the vaccine. But now there's one challenge. 2 weeks ago, I had the CS saying the vaccines are in plenty and they're free in Kenya, but now they are worried because they may end up expiring and it's so bad. So what we are doing at the moment, we are trying to do door-to-door sensitization and linking those ones who haven't gotten the vaccine to a nearest either church or polytechnic. And then now we partner with a health facility and we organize with the nurse so that she can go there in the afternoon and immunize the people. Thank you so much. And then there's the issue that you addressed about how many times we can be meeting. I would suggest monthly basis, but if need be, you can also call an impromptu meeting. Thank you.
Thank you, Christine, for giving your very rich experience of working in the community systems in a rural setup in Africa and in Kenya. So members, if there's no other intervention, so one of the closest campaign that we need to participate in is a TRIPS campaign for WTO, sorry, World Trade Organization. And I'm looking for volunteers. If, I need to get your consent. Whoever is interested, please put your name on your name and email on the chat to be part of the small group, or I'll put my email in the chat for you to just write to me. We need to quickly convene and take action. If it means going to embassies, the US, the European Union, because they are the ones who hold patents. They are the ones where the big pharmaceutical companies are hosting the headquarters of these companies. We need to go to them. The same way we do other campaigns, I think now we need to come out in big numbers. And we are not saying in a few countries like South Africa, we are talking in the whole part of Africa. We need to decide on which day are we sending all those letters, in which day are we going to all those embassies. So I look forward to getting volunteers on the chat. I can see Christine has volunteered. Again, I want to suggest that I know you work in your respective countries. We need you to write op-eds, get in touch with media. Also, if you want any support, just reach out to me. We see how we work around it. We need to bring up the issue of TRIPS, health injustices back to the table. It's not just about politics. This is also politics of health. So I also want to request that members, you can do op-eds in your respective countries, and please share with us the links. As Barack said, Twitters, tag us, and we can amplify the message. So we have 2 volunteers. We will get in touch, Basi and Christine. Any other, we welcome any other, even after the meeting. That is the closest, because I think we need to start building a movement. We are enough. I'm saying we are 14, 15. We are enough to start a movement in our respective countries, and then we'll have other people join us. And we want to ask you to ask civil society, local civil society, to be members. We already sent out a call. We already sent out a call in our social media platforms. Please ask members to sign up to be members of PVA Africa. We will be doing quite a number of things in the coming months. Thank you, members. There's Sofapadi, there's Kavengo, thank you. So even after the call, you can reach out to us, Tian, myself, Barack, or Anna. Please reach out to us. Someone has said they will be doing an op-ed, which is very good. Morinike, yeah, very good. And she is asking to leave for another meeting. Thank you so much, Morinike, for joining. So Christine, for you to be a member, there's a link. Maybe someone can just share the link on the chat to be a member of PVA Africa, but on social media, on our Twitter and Facebook pages, we have a post and a link of how you become a member. We get your links, we get your contacts, your email and telephone number for ease in communication. So members, any other intervention? We are right on time. We have just used 1 hour. So I want to open up for any other intervention. So thank you so much. If there's no other business, I want to take this opportunity to thank you. Oh yes, Tian.
Thanks, Rahab. Hey colleagues, I know we've spoken about it a bit, but just really wanted to implore you to please continue sharing our call for proposals. We have a few days left towards the deadline. Please share it with your community groups, even the smaller groups who perhaps are not even registered yet, groups that have been working on the forefront since the beginning of the pandemic. Please do share with them the call for proposals. Our aim with these small grants is really to ensure that we provide support to radical advocacy work. So we won't be particularly excited about doing the mainstream work that perhaps we all know and love, you know, the scorecards, the stakeholder consultations. Whilst all of those have their place, this particular grant is really for advocacy, radical advocacy, to push the envelope and to create discomfort, which is what we like to believe here at the Alliance we're all about. But just to echo what Rahab said, and thank you all for joining, you know, and spending time with us. We're hoping in the next few months to make this PVA Africa circle bigger. The continent is certainly big enough that we should be having a really robust African representation across PVA Africa, because it really helps us assert our voices and our agendas on the global scene. I've just completed an interview now with BBC World Service around the Pfizer announcement that they are setting up this just world, healthier world partnership that, unfortunately, in my view, has received the support from Rwanda, Ghana, Malawi, Senegal, and Uganda. And that's really unfortunate, because at the beginning of the pandemic, we kept on saying we're stuck in a cycle. Thanks, Christine. Someone will pop. Christine, if you go to our website, africanalliance.org.za, you apply directly from that website. And the form is embedded in the website as well. But I think on this Pfizer issue that they've just announced, the challenge here is that this continues positioning African countries and our so-called leaders as people who will keep on going cap in hand. Please, master, give us more, give us more. We don't want charity. We've never asked for charity. We've always asked for justice. And by a pharmaceutical company who has kept us in this pandemic unnecessarily and created billionaire after billionaire, to now come and set up this structure is just absolutely outrageous. The fact that they've set up the structure at Davos tells you that they're speaking to their people. They didn't choose the World Health Assembly, they chose Davos. And that tells us everything we need to know. Again, they've selectively looked at certain low to middle income countries and not all. So these people are not about inclusivity or ending pandemics in a meaningful way. This is PR spin, but this is a perfect example of why we need such a strong PVA Africa base, so that media and partners can call on us and we can provide a diversity of voices. As Kavengo so beautifully put it, you know, we're such a diverse continent. And me sitting here in Joburg, Anna sitting in Harare, Rahab sitting in Nairobi, you know, don't represent the breadth and the width of Africa. And so it's really important for us to really support those so-called grassroots community voices. But thank you so much, everyone. And thank you, Rahab, for guiding this process. And looking forward to seeing you all at the next meeting.
Yes, so thank you, Tian, for that good update. I think it will form some of the communication that we'll be pushing out in the next 1 week or 1.5. I have noted the people, so by today, if I have your emails, I know I'll get your emails. I will form a small group that we quickly convene and start doing our campaign and doing messaging and all that in good time. So if there's no more agenda to discuss, I want to thank you once again for having time to join. I know there's a lot going on. We have our projects we're implementing, we have WHA, of course we have Davos, we have many things. We also have a Health R&D conference happening at Strathmore Business School here in Kenya. So we thank you so much for getting time. So the next meeting, we usually have PVA civil society meetings once a month. We'll send out a communication in good time and an agenda for you to see and get involved. So thank you so much, comrades, and I look forward to meeting you very soon. Thank you.
Thank you.
Thank you, Rahab.
Thanks, Rahab.
Rahab.
Good evening.
Bye-bye.